If you have been told you're eventually going to need a replacement, I want to talk to you today because there's a conversation that happens in clinics and offices all around where a patient comes in with knee pain, the x-ray shows some, some degeneration, some arthritis, and they say, um, you get cortisone for now, eventually you need a knee replacement, and then you leave. But there's probably an entire category of treatment that was never mentioned. And we're gonna fix that today. Okay, in case we haven't met, I'm Chiagozie Fawole, Dr. Chiagozie Fawole. I'm the founder of Ivie Health in Syracuse, New York, a physician-led regenerative medicine practice. And the thing I do is that we have conversations that didn't happen in the clinic. And in this video, I'm going to walk you through a couple of non-surgical options, three non-surgical options for knee pain. So if you're in research mode, this is probably your hub for the day. And by the end, you'll understand what each one is, how they're different, who they'll work for, and who they'll don't. Now, we will touch on three things. Number one will be PRP. Okay. Number two, you may not have heard of it, will be A2M. And then number three will be focused shockwave therapy. So grab your pen, grab your paper, grab that coffee, grab that, grab your fun drink, okay? Because you're going to need to pay attention and be here. Put the kids away, grandkids, whatever it is, tell them that you will be back because I want to be honest with you. Um, Today and basically give you questions, empower you to have the conversations with your doctors. And if you want to then come work with us, fantastic. We'd like to take care of you. All right. So why have you never heard of this? Here is the fact, okay? The field of regenerative medicine is one, I would say, of the newer, and the key word there is with an ER, not new, newer fields of medicine. Um, because a lot of research has been coming out over the past few years that has really caused this field, should I say, to blossom, to expand. Um, and let's get right into it. Option one is PRP. Okay, let's talk about PRP. So platelet-rich plasma. This is probably the most well-known of the three. It's PRP stands for platelet-rich plasma, and this is what it means in plain language. Okay, you probably remember this from biology, from like I don't know, ninth grade or something, right? Your blood has platelets. They're like the sticky little things that help your blood clot when you like cut yourself or bruise yourself. Now, one thing that platelets carry are called growth factors, okay? And growth factors are basically the like flashing signals to your body that say, hey, come repair here, okay? So when we do a procedure with PRP, what we do is we draw a small amount of your blood, we take it and basically spin it down so that we can separate but also concentrate the platelets. And then we're able to inject that concentrated plasma that is now rich in platelets directly to where needs to be treated. Okay. The goal is to be able to flood that joint with your own growth factors, not to mask the pain signal, but to basically send out like massive flares to tell the body, like, come heal this spot. And what it does is that the body gets to work repairing what was hurt. Now, one thing you have to understand about PRP treatments is that it's not like a cortisone shot. You wouldn't necessarily feel dramatically better in like, 2 days, okay? Because we're literally having your body heal. And so tissue usually takes time to respond. And I would say most people find the most meaningful change within weeks. So we're talking about weeks like maybe 8 through 12. Some people will experience improvements earlier, but I'll say kind of it takes a couple of weeks, but the important thing is that it lasts longer, okay? So, while of course, you want to have the like really nice quick response, this one, it kind of takes a while, then you start to feel more of a response. Pain improves, and then it kind of stays down. Okay. Who tends to respond very well to PRP? I would say people with early to moderate joint degeneration, basically active adults who want to maintain their function. People who maybe have had cortisone shots multiple times, but they keep having to go back. People who are not yet at the stage where surgery is the only viable option. Okay. So again, I like to say like it's not every single person that you can treat with PRP, but at least you want to know if you're still at that phase where PRP can help. Now, who may not respond well? People with severe, end stage arthritis where the cartilage is basically gone because you kind of need something for the body to work with, right? If the tissue is too far gone, the growth factors don't really have much that they can latch onto. In which case, yes, you probably will need to have that, surgery done. But this is why we have conversations. This is why you don't go off a YouTube video to make your clinical decision. This is why, we get to see you. We get to see you. Now let's talk about option two. Are you still with me? You're still with me. You're still hanging with me. All right. Let's talk about number two. This is A2M, okay, or alpha 2 macroglobulin. This one, I can tell you, most people have never heard of, okay? This is a protein that exists naturally in your blood, like you have it already. And it does something very specific. It so when a joint is basically breaking down, basically what causes like arthritis and pain and all of that, there are some enzymes in the joint fluid that are literally just like termites, right? They're breaking down the cartilage. They're like agents of destruction. They're like termites. They're there, they're active, they're doing damage. And A2M is kind of like the security guard, right? It's like it's what I call like a molecular trap. So basically it goes in there and it nabs onto these like destructive enzymes and neutralizes them. Okay. So when we take it from, again, also a blood draw, also spinning it down right there in the office. Okay. And when we inject it into that joint, say your knee or, shoulder, whatever, A2M is basically able to neutralize those destructive enzymes, and it doesn't just reduce the pain signal, it goes after the mechanism that's causing the cartilage to break down. So that is the key distinction between A2M and PRP. PRP is primarily about basically repairing the tissue, but A2M is primarily about basically stopping the breakdown. So I kind of think of A2M as like the security guard that like traps all the bandits, and then PRP as like the fertilizer that basically says, okay, come here, and heal. So in some cases, we'll use them together, basically let A2M halt the damage and PRP start the repair. Now, who's A2M for? It tends to be most effective in patients with active joint degeneration. So we're talking early to mid-stage osteoarthritis, people who are losing cartilage and they want to stop that process. It is not a last resort. It's actually better deployed earlier in the progress before the damage is too advanced. If you wait until the joint is too far gone, even A2M has its limitations. All right, let's go to number three. Number three will be shockwave therapy. Okay, this one may be my favorite. Okay, because again I like to be very upfront with you. The other ones kind of take a little while to kick in because you're like letting the body kind of do its thing. But shockwave therapy, however, right? People tend to see significant results even by the first one. But usually just one is not enough, but at least they start to feel some relief by the first one. So I'm kind of really happy about this one again because we try to use them together. So now when we say shockwave, the name sometimes may sound a little intimidating, right? Focus shockwave therapy, right? You're probably thinking of like, those like olden days videos, where you like attach someone to like electrodes and like shock them. No, 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 no. We're not doing that today, okay? It's not an electric shock per se. Basically, it is acoustic waves. So basically sound waves, right? Sound energy that is basically focused and delivered to a specific area of tissue. And what it does is that it stimulates blood flow through the to the area, helps kind of break up calcifications. It promotes helps your body basically build up collagen and remodel because it's supplying basically new blood flow to the area. Without getting too technical, it can basically interrupt the pain cycle um, by affecting the nerve endings that get to the tissue. So, how does it feel? Some people would describe it as like either a tapping or a vibrating sensation. Some areas are more sensitive than others, but it's not like I'm shocking you electric, like nothing like that, right? Okay, the sessions are typically short. It can be anywhere from, 10 to 15 minutes, not long at all. We normally do a series, it's not a single session. Now, where does shockwave fit? Okay, it's excellent for like, tendon, soft tissue problems around the joint, patellar tendon, hamstring pain, Achilles problems, even like plantar fasciitis if you have like foot pain. It's also used as part of a kind of a broader joint protocol alongside PRP or A2M. Like some people, for example, will do a couple of shockwave treatments and then come in with either A2M or PRP or both. And here's the thing, some people may come in thinking that they have like a cartilage problem, and then it actually turns out that they have their pain coming from the soft tissue around the joint. So shockwave can end up addressing that while PRP or A2M address the joint itself. So how do we decide what is right for you? Again, not everyone who comes to see us end up getting a procedure. The first thing we want to do is, first of all, even identify if you're a candidate or not. We get your history, your imaging, your symptoms, your goals, what other things you have going on. Are you on medications that, need to be held? And, like there's a whole, each person is different and it's usually like a whole picture that we're evaluating. And then sometimes, we'll let you know if you're a good fit. If we don't think it's a great fit, sometimes we will even get imaging. And let's say if you already have recent imaging, then we don't have to do that again. Um, because we want to have just a, good conversation, honest answer, what's your best next step. And then if you're a candidate, then we walk you through which option or combination makes sense for your specific situation, PRP alone, A2M alone, or together, or with plus or minus shockwave or bundled. There's no one size fits all. So wherever you get to go for this, if it's here with us at Ivie, somewhere else, make sure you ask these questions. Number one, who's doing the procedure? Is it a physician or is it somebody in the office? And number two, what does the consultation look like? How do they screen, etc. And then what kind of imaging are they using to guide their diagnosis and or treatments? We use ultrasound to make sure that we're actually getting to the right spots because each person is different. Landmarks don't always tell the whole story. Ultrasound helps us kind of see where a needle is going, so we're not, just dumping your blood products back into just random places. And then also ask them what the timeline for results look like. And then what happens if you don't respond, right? If you're a candidate, if you're not, you want to get clear answers. All right. So anyway, so today we kind of talked about three things. You may or may not have heard about them before. So PRP, A2M, and then shockwave. And in the next couple of videos, I'll actually do a deeper dive into each one of these. You can watch those videos in sequence or whenever you're free or whatever. So anyway, if you are in Central New York or you want to fly in, we do have an airport. It's SYR. So yeah, we are at Ivy Health right off 81, and the link to book a consultation will be down below or to get into our world. And if you know someone who's been sitting on that, eventually you'll need a knee replacement or a shoulder, surgery or whatever, for months, for years, you can send them this video because the conversation they didn't have might still be available to them. Again, I'm Dr. Fawole, and I will see you on the next one.